this is Chandler Rose, and this is part of my Trigger Point series, which you can find on wellnessplus.tv. And today I'm going to be addressing trigger points in the arm that are really good for helping with any kind of wrist issues. Also really great for hand tingling or general pain in the hand and wrist. So let's get started. So today I'm showing you this work using a mat, and I have her knees bolstered and her head on a comfortable pillow. It's a little different than using a table, but I just thought this would be a good way to do it at home. So when you're doing this kind of work on the arms and hand, you just really want to be careful of any injuries in the wrist. And Adrienne actually has some tendonitis around her wrist, so we're going to be careful of that area and still address it with these trigger points. So I'm going to start by applying a little of my very soothing hemp oil blend. And anytime I'm doing trigger point therapy, which involves very tender spots that show up with common referrals in the body, I want to start just by warming up the tissue and connecting with the client with some really easy Swedish pressure. A lot of people complain of carpal tunnel symptoms in the wrist or hand. And if it's just symptoms and they haven't been diagnosed with carpal tunnel syndrome, then massage is one of the most effective treatments for those symptoms. So I'm coming down to the base of her hand with my fingers and just warming up the hand a little bit there, using medium pressure. And you want to encourage whoever you're working on just to let their arm completely go. And if you have to bend the elbow on occasion, just to make sure that they're not holding their arm up. You want their arm to be very relaxed and heavy. Trigger point also involves breathing. So anytime you work deeply on a point, and I'm going to start by working on a pretty easy point to find, and I'm just going to encourage her to slow her breath. And as I work on that point, I want her to breathe in to the count of 5 and exhale to the count of 12. Just kind of a good way to get people really slowing their breath and thinking about the exhale being super long and drawn out. So this trigger point is just below the elbow joint, and you want it to be on the top of the arm. And you can either go in with your thumbs stacked, or you can use one thumb depending on their comfort level. And oftentimes when I work on this area, people are really shocked by how tender it actually is there. And is that a comfortable pressure for you or too much? Okay. So trigger point involves a certain amount of healthy discomfort. You don't want it to be deep pain, but you almost want to work to an edge where they're just ready for you to stop working on it and you give them a break. So a good way to experiment safely with trigger point is to hold a point for about 5 seconds. And if they seem like they're tightening up, then maybe give them a break at 3 seconds. But you can hold a really good tight trigger point for up to 20 seconds. And then after a couple minutes of doing that kind of work, I always like to go back to some Swedish lengthening techniques, just to allow the body to integrate the work and relax a little deeper. And again, a lot of these points are all lined up in this area, so I'm just going to move a little lateral towards the elbow. And my right hand is my strong hand, so I tend to use that a little more, my thumb there. And on a really tight person, which is most of us, these tendons are going to feel like guitar strings, like tight guitar strings. So you can experiment with holding some of those little bands. And she's doing great at breathing. And you'll be able to tell if the person is feeling a little tighter in one spot or a little more discomfort. Maybe they'll breathe a little deeper. That's good. You just really want the person to be breathing and not holding their breath, because that can really happen often too. So I'm moving a little bit towards that crease where the elbow bends into this area here, and holding these points. And some of them, a true trigger point will offer referral. And referral means they're feeling the sensation radiating out of the place that you're pushing on. Sometimes that area will be just directly where you're working and a little bit around it, like a circle. Sometimes they might feel this referral in their other foot or something completely random. So referral is very interesting in that way, but it reminds us that the body is whole and connected. And I like to see the body as a pulley system. So if you can do trigger point work and do it with the intention of loosening a little bit of everything in the body, then the places that may have some history of overuse or injury or weakness or surgery or trauma can relax and not be pulled on quite so hard. And you'll start to see this area get a little flushed. And I'm just moving down. And these muscles, if you want to know more about these specific muscles, you can look up the extensors in the arm. There's extensors and flexors, and the extensors are on the top of the arm. And each extensor muscle connects above this area and then down into the hand or wrist. And so generally this portion has trigger points all lined up. So if you can just spend 5-10 minutes in that area, it really is going to help the hand and wrist below it feel much more loosened. It's also really good to point out there is a nerve that runs through the arm and down through the carpals and the wrist, and it's called the median nerve. And if you have someone experiencing any kind of wrist discomfort, a lot of times it's because these muscles that we are addressing today are encasing this median nerve and causing the wrist to feel off balance in a way that may be causing tingling or numbness in the hands. So I do know a lot of people that have had surgery for carpal tunnel, and I think maybe there's a small percentage that helps relieve those symptoms. But so much of what's happening with that kind of discomfort is that it's not the wrist, it's the extensors up here. And if you can encourage anyone dealing with these kind of issues to get massage before doing anything more dramatic, that can be a good way to offer easier relief than having to have something permanent happen. Carpal tunnel symptoms are very treatable with massage. So I'm going down a little bit now that I feel this is more open. I'm going below it and working some of those same muscles but different trigger points. And you want to go into a depth that you're feeling increased malleability, which is making the muscles softer, almost like clay. And if you're increasing malleability, you are creating space, and that nerve can really have more space to just do what it should do and not refer pain. The next area I'm just going to touch in on is the area above her wrist, in her palm. And I have a video where I talk about the universal trigger point, which is here. And on the top of the hand, it's between the thumb and the first finger. And then here, if you open the hand, it will be, in the same place, but on the inside. So anytime someone is having any kind of wrist issue, I like to check in with this trigger point. And a good way to access it is to use a pincer palpation technique and just hold that point to their comfort level. If you feel them kind of tightening up, or if their breathing is more shallow, then maybe back off with pressure. But opening up the hand is also a really gentle way to address trigger points that will really offer more support for the wrist. And a lot of times when we're lifting a lot, or even texting or computer work, anytime where your hand is tight and tense in one posture for a long period of time, these points will be tight. And the points around the thumb joint, which is a saddle joint, it's kind of complex. So even just giving her a little work in this area will allow those carpals below it to have a little more space. And you can treat any tight, tender nodule like a trigger point in the way that you want to increase malleability there or movement in the tissue. But not all tight nodules are trigger points. Technically, trigger points are the ones that offer referral. Then again, loosening muscles overall will support what you're trying to do, which is really help that wrist out and that forearm. And you can work at the base of the palm here, above those carpal bones, and you may find some trigger point referral in the hand as well. And just holding 5 seconds, maybe 10 or 20 if the person is receptive to that, and making sure your breathing is relaxed, which is encouraging their breathing to be more relaxed and slow. And a very safe technique for allowing the fascia, which is the tissue around these tendons and ligaments, to relax, is basically you want to find the notch in the wrist, which is between this bone and then the thumb. There's a little notch there. And you want to just squeeze in towards the midline. And you might feel those bones slightly adjust a little bit and pop. And this isn't a deep, deep technique. It's more just a little fascial stretch. And that also allows her to have more space in there. And then the other side, your finger is between this bone and the bottom of the hand. And after a little bit of trigger point work, I like to just come down to each finger and just give each finger a little pressure, a little stretch just by pulling out towards me. And you want to be careful of the nail bed. You can even go around the nail bed. Sometimes people have really sensitive nail beds. And addressing every finger in a way that is a part of the whole hand, which is connected to the wrist, and then the elbow. And the last area I want to address for trigger points is back here, just above the elbow. What I'm doing is just putting my thumb in this little notch just above the elbow, and this is going to help release these little muscles that wrap around towards the arm and also affect some of the muscles that connect into the wrist. Do you want more or less pressure there? So sometimes this area will be really tender. You want to be careful. And then anytime you go up above this area into the triceps, it can get really, really less pressure is more when it comes to releasing muscles. And then I just want that, just relax that shoulder, good. And you can even use your finger underneath there. And I know it's hard to see with where I am, but on me it's this area here. And these are all techniques that you can do on yourself. This also is really good for elbow pain or tennis elbow. You just want to be careful of this area above, which is the triceps, which is also really good to get massaged, but typically very tender. So I always tell people, don't work as deep as you think. Really kind of stay superficial. A little bit goes a long way there, but there's a few trigger points in that elbow and everyone's a little different. So even just holding, she's in a real relaxed position just for me to kind of feel around with my fingertips in the elbow. And then a trigger point is either going to offer some sort of referral or you'll feel that nodule under your fingers. And I'm going to use a little more of my oil. So I'm using a combination of tree oils today, which are very good for breathing and they're very relaxing. They're also very grounding. I really like tree oils in the winter time because everything is colder and these oils offer this kind of warming reminder that any kind of deep woods, tree oils, balsam or cypress or fir kind of goes along with where we are seasonally. So I'm just touching in on her biceps. Anytime you do trigger point, 5-10 minutes, 20 tops, you always want to offer some relaxation for the rest of the arm. And there's an area just here above the elbow that tends to be tender in the biceps. So I'm just applying some medium pressure along that area. If you'd like to check out more of my trigger point videos, you can head on over to wellnessplus.tv and you can sign up for a free 7-day trial. Hope to see you there. Thank you very much.
With hundreds of videos that you can stream on virtually any device to help you reduce stress, lose weight, or just improve your health and well-being overall. At wellnessplus.tv, we are dedicated to helping you on your health and wellness journey. Join wellnessplus.tv to find hundreds of videos to help you improve the health of your body and your mind. wellnessplus.tv. Get well, feel better.